Hello, everyone. For week 2 in Chronic Illness and Healthcare, we are exploring what feelings those who live with chronic illness experience and how they manage or accessorize these feelings. The chronic illness I have chosen for the course of the class is migraine, since I myself am a migraine sufferer. This PowerPoint will identify 3 resources of support for those who do suffer from this chronic illness and discuss the similarities and differences between the readings from this week and last week. We will begin by first defining what exactly a migraine is. A migraine is a chronic neurological disorder typically lasting 4 to 72 hours, with phono or photophobia or both, nausea and vomiting. They may also be classified on whether an aura is or is not present. An aura is characterized by a precedent symptom or symptoms such as neurological dysfunction, which include fatigue, neck pain, and/or repetitive yawning. There are many different classifications of migraines, including migraines with or without aura, basilar, hemiplegic, vestibular, retinal, and chronic migraines. Each of these different classifications have their own specific set of diagnostic criteria. Over 36 million Americans are affected by migraines, with more women being affected than men. There are a variety of treatment options available for those who do suffer from migraines, but keep in mind that treatment options may be unique to the individual, meaning what may work for one individual may not work for another. For the web quest this week, a variety of search terms were used. Some of the terms used include migraine, migraineur, which is a term used to describe those who suffer from migraines, feelings paired with migraines, for example, anger and migraines, frustration and migraines, etc., and support for migraine sufferers. After reviewing the search results for each of the searches, I chose the Daily Migraine and the American Migraine Association as 2 resources, as they were both mentioned within all of the searches. I also conducted a separate YouTube search for migraine stories so that I could find a migraineur who could share their story and encourage others who live with this chronic illness to reach out for support. The first resource chosen is the Daily Migraine. The Daily Migraine was created by Lisa Jacobson, who is also a migraine sufferer. Her goal was to create a community to help as many people as possible get rid of their chronic migraines through help, healing, and humor. The Daily Migraine has over 250,000 members and offers a variety of information. There are endless discussion boards, which is where we can see individuals discussing feeling exasperated or frustrated, identifying their common triggers, and offering their experiences with certain treatment options. The site also allows its members to search for local doctors who specialize in treating migraines. Lisa also offers her own personal 3-part healing process for individuals to try, which includes a treatment idea list, migraine diary, and doctor appointment companion, which she herself has created and is free to download via the website. The Daily Migraine would be an excellent means of support for someone who is newly diagnosed with migraines. The second resource chosen is the American Migraine Foundation. The mission of the American Migraine Foundation is to mobilize a community for patient support and advocacy, as well as drive and support impactful research that translates into treatment advances for patients with migraine and other disabling diseases that cause severe head pain. The website includes numerous information available free of charge to the individual, as well as identifying treatment options and local doctors who provide these services. News articles are updated daily to provide migraine sufferers with the most up-to-date information and advances in relation to this chronic illness. The American Migraine Foundation also has created a database, which is called the American Registry for Migraine Research. This database contains information about patients newly diagnosed with migraine and other headache disorders to help scientists advance research and treatment options available. The American Migraine Foundation is an excellent resource for an individual who is newly diagnosed with migraines so that they can learn more about this chronic illness. The last resource is a YouTube clip titled Jessica's Life with Migraine. Jessica is a migraine sufferer who started to get migraines in 2007. In the beginning, Jessica interpreted her symptoms as just a headache and took over-the-counter medications to help. Her life continued on. She went back to work, back to school, and took care of her son. Her headaches continued, and she continued to ignore her symptoms until her symptoms got so bad she scheduled an appointment with her primary care provider. Her PCP referred her to a neurologist who diagnosed Jessica with migraine. This term was new to her, and she states that she had never heard it before. She began a treatment regimen prescribed by the neurologist and even tried different alternative medicines. They seemed to provide no relief. Jessica was subsequently hospitalized twice due to her migraines. This forced her to quit her job. Her fiancé ultimately left her, and she lost her group of supportive friends. She now turns to online support groups and explains how establishing relationships with others who are also migraine sufferers provide a sense of comfort. This video, which is attached within the slide, provides an insight into the day in the life of a migraine sufferer and also shows that a newly diagnosed migraine sufferer is not alone when dealing with this chronic illness. Between this week's and last week's readings, there are multiple similarities that can be identified. Most similarities can be seen between the daily migraine and Jessica's personal story. By reading some of the discussion boards within the daily migraine, you can begin to notice some of the feelings that were discussed within the readings, such as hopelessness, frustration, and fear, which are some of the most common. One migraine sufferer who posted within the discussion stated that she had exasperated all treatment options and was looking for other recommendations from others within the community. Another is the husband of a migraine sufferer and is voicing how he feels like he is helpless watching his wife suffer and how he feels guilty. Another sufferer within the discussion board writes how she is about to lose her job because of her migraines. This can be related to the article that was read this week by Checkton, Green, Magsamen, Conrad, and Vanitas, and the section titled Illness Interference. Migraines have directly interfered with this sufferer's ability to complete her job duties. Therefore, she must quit her job or she is about to quit her job. Jessica's experience describes many similarities. The first to make mention of is discounting symptoms. In 2007, when Jessica first started experiencing migraines, she interpreted them as just a normal headache. After getting to the point where the pain would become unbearable, Jessica finally went to her PCP, who referred her to a neurologist and finally got a diagnosis. This can be related to Karen's story and If You Have to Wear an Ugly Dress, Learn to Accessorize. She waited and waited until her symptoms got progressively worse to see her PCP. Jessica almost lost her entire support system. Or she did lose her entire support system, which included her fiancé and friends, which is similar to what Linda experienced with her husband when she was diagnosed with lupus. Jessica turned to finding support groups, which is where she found a sense of comfort. In the book, If You Have to Wear an Ugly Dress, Learn to Accessorize, the text states that these groups can offer a warm and understanding atmosphere and another safe place to voice your pain and grief. By listening to Jessica's story, you can also hear in her own words her migraine's illness trajectory, minus the downward and dying phase, which was discussed in week 1 of the course. There are a few differences to mention between last week's and this week's reading in relationship to the resources chosen. Self-blame is mentioned within the discussion board on the daily migraine. Self-blame is something that was not mentioned within the readings, but can be a significant term when it comes not just to migraines, but any chronic illness. One migraine sufferer writes that she feels as though she does not take her migraines seriously enough, and she blames herself for having them or for not getting her work done when she does have one. This is a direct disruption that migraines can have on an individual's everyday life. Another difference was heard in Jessica's story when she mentions the young girl, Melissa Dwyer, who took her own life because of her migraines. In the illness trajectory, the final two phases are downward and dying, which I mentioned in my paper last week does not usually happen unless corrective action is taken too late in the crisis phase. But in this situation, death did happen to this young woman because of her chronic illness. She committed suicide at the age of 22 to end the pain and suffering she was experiencing from her chronic migraines. It's important to note that just because these resources were chosen for this presentation, they are not the only available ones to migraine sufferers. There are many resources out there available. Due to the differences in the types of migraines and symptoms that are experienced, those who suffer from migraines should search for stories and resources of support that are specific to their circumstances. This will help those who may be newly diagnosed learn to accessorize early on in their chronic illness. Another important note is to never discount symptoms that are not normal. As soon as an individual experiences something that is out of the ordinary or not normal, they should call their PCP immediately and be seen in the office. Do not Google diagnose yourself. Google is not your PCP and cannot diagnose you. Plus, due to the vast amount of classifications of migraines, your Google search may be vastly incorrect. A complete neuro exam should be performed by your PCP and a referral to a neurologist should be made to reach a diagnosis early on. By allowing these symptoms to keep occurring without a proper diagnosis, the individual is letting the illness lead their lifestyle when it should be the other way around. As you can see, migraines can be a debilitating chronic illness. Individuals who are newly diagnosed should first educate themselves on the basics of what a migraine is, followed by treatment options available. If one is having difficulty accepting this new diagnosis and begins to experience feelings of hopelessness, frustration, or anger, the individual should reach out to an online support group for a sense of comfort. Learning to come to terms and accept your migraine diagnosis and accessorize it will help you live a balanced and fulfilling life. Thank you for listening.